Welcome everyone, and thank you for viewing this session, Data Analytics and Public Health. In this video, we'll explore how we, as public health practitioners, can use data and analytics to drive real-world change in public health. We'll talk about how we can use data responsibly, equitably, and with purpose to uncover insights, solve challenges, and make informed decisions to benefit the communities we serve. Before we dive in, here's a quick look at what we'll be covering. We'll begin with a brief introduction to the role of analytics in public health and set the stage for what's to come. Then, we'll walk through case studies that demonstrate different types of analytics and how they have been applied to real-world scenarios. Next, we'll shift to the foundations of analytics, covering key concepts like data preparation, security, and collaboration. After that, we'll look at some of the most impactful analytics tools available today and the core capabilities they enable for their users, like data analysis, visualization, and reporting findings to a variety of audiences. From there, we'll tackle a critical topic, mitigating bias. We'll discuss how bias can impact our work and how we can address it. Finally, we'll wrap up with visualization best practices to make sure our insights are clear, impactful, and actionable, before concluding with a review of key takeaways. It's important to note that this presentation primarily focuses on what happens after the data is collected. While the processes of how, why, and from whom the data is collected are critical for building trust, fighting bias, and supporting meaningful change, those stages of the data analytics journey are not addressed here. Analytics is the process of collecting, processing, and interpreting data to guide decision-making. In public health, it plays a crucial role in understanding population health trends, predicting events, and evaluating the effectiveness of interventions. A people-first approach to analytics means showing respect and consideration for the community our data belongs to, including being transparent with how we use and share data as actionable information. These practices ultimately help support health equity. When starting an analytics project, it's important to take a moment to think about what we're trying to accomplish and who will be affected. It all begins with understanding the affected communities. Public health challenges don't happen in a vacuum. They're shaped by social, economic, and environmental factors that influence outcomes. Considering these factors gives us a more complete picture of the issue and the context behind it. We also need to define the problem. What specific challenges are we tackling, and how are our communities feeling the impact? Getting clear on this helps us focus on what truly matters. Finally, we have to stay focused on the bigger picture. Having data is great, but how we use it is what matters. Understanding these principles can help us appreciate seeing them in action. We can use several different types of analytics: descriptive, diagnostic, predictive, real-time, and prescriptive, to uncover insights and drive meaningful change in our communities. Each type of analytics plays a unique role in addressing current public health issues. To illustrate this, we're going to walk through a series of real examples that show us how these different types of analytics can move us from understanding past trends to shaping proactive, data-informed decisions for the future. As we explore these examples, remember that behind every data point are real people with real lives, and public health practitioners ensure human dignity when they make thoughtful, responsible choices. Descriptive analytics forms the bedrock of our work in public health. It tells us what has already happened. By summarizing and interpreting historical data, we uncover trends, patterns, and outcomes that help shape informed decisions for the future. Public health relies on descriptive analytics in countless ways. Think of the data you might see in an annual report: the percentage of the population vaccinated against COVID-19, or the number of families newly enrolled in WIC. These numbers don't just tell a story, they lay the groundwork for action. Descriptive analytics serves multiple purposes. Tracking community health patterns helps us monitor trends, such as substance use, to anticipate potential challenges and respond effectively, while having timely and accurate data empowers proactive efforts like education and early intervention. Descriptive analytics can help guide us in targeting outreach and allocating resources where they're needed most. And by sharing these insights with communities, we enable informed decision-making to protect health and well-being. For example, in Pima County, Arizona, descriptive analytics was instrumental in understanding youth substance use trends, a crucial first step toward designing effective responses. These infographics, taken from the 2015 Substance Use Among Youth in Pima County report made publicly available online, are a great example of descriptive analytics in public health, showcasing how the county analyzed historical survey data to understand trends in youth substance use behaviors. By summarizing these patterns, the county identified high-risk groups in key areas of concern, helping to inform targeted prevention efforts and resource allocation. This approach also highlights the value of sharing clear, accessible data to build public awareness about critical health issues, ensuring communities are engaged and informed. Descriptive analytics like these focus on understanding what has happened in the past to guide future actions. Diagnostic analytics takes us beyond the surface, helping us understand the reasons behind the trends we've observed. It allows us to ask critical questions about cause and effect, providing insights into the factors driving disparities or challenges. For example, the United Health Foundation's 2024 Maternal and Infant Health Disparities Data Brief sheds light on persistent disparities in maternal health outcomes in the United States. Birth-giving individuals from American Indian, Alaska Native, Black, and Hawaiian Pacific Islander communities experience maternal mortality rates 2.5 to 4.5 times greater than other groups. Diagnostic analytics is vital in understanding why these disparities persist, examining social determinants of health, access to care, and structural inequities. By pinpointing these root causes, we can design targeted interventions and policies that address not just the symptoms of inequity, but the systemic issues driving them. Data Haven, a Connecticut-based nonprofit, exemplifies how data can be leveraged to drive equity and well-being. Through their research, they provide critical insights into social and health metrics, equipping policymakers, healthcare professionals, and community leaders with the tools needed to make informed decisions. This chart from Data Haven's 2023 Health Equity Report is a powerful example of diagnostic analytics in action. By analyzing maternal and infant health outcomes across race, ethnicity, and geography, the data reveals stark inequities. For example, Black parents in Connecticut face significantly higher rates of fetal and infant mortality compared to white parents, echoing national findings from the United Health Foundation. Diagnostic analytics like this empowers us to design evidence-based interventions, paving the way for more equitable health outcomes in our communities. Predictive analytics helps us look ahead, using data to anticipate challenges and prepare for them. In public health, it's a powerful tool for addressing complex issues like air pollution and its far-reaching effects. Predictive models analyze air quality and exposure data to estimate future health outcomes, such as increased risks of respiratory conditions. They also forecast healthcare needs, helping communities anticipate and plan for long-term impacts. Beyond health, these tools assess environmental effects, such as potential decreases in crop yields, enabling earlier conservation efforts, and shaping informed environmental policies. Predictive analytics also models how urban development scenarios might influence pollution levels, guiding policies to reduce emissions and improve air quality in areas most at risk. Predictive models support decision-making by estimating the economic impacts of pollution, such as healthcare costs, reduced workforce productivity, and industry effects. Environmental Insights is an open-source Python package created by researchers at the University of Exeter, aiming to democratize access to air pollution data. This tool enables users, even those without specialized technical skills, to retrieve, forecast, and visualize air quality trends. The image we're viewing illustrates how nitrogen oxide, NO2 concentrations, would increase along a proposed roadway. NO2, produced from combustion, is linked to ground-level ozone and particulate matter, both of which harm ecosystems, water bodies, and soil. In humans, long-term exposure to NO2 can impair lung function and increase vulnerability to respiratory infections. Monitoring and predicting NO2 levels are therefore essential for managing air quality and assessing the potential environmental and health impacts of infrastructure projects. By combining a variety of data sources and models, Environmental Insights simulates future air quality under various conditions, enabling users to explore how factors like wind speed or traffic changes might influence pollution levels. Real-time analytics provides an immediate window into public health dynamics, enabling us to track and respond to events as they unfold. Instead of relying on delayed quarterly or annual reports, we can act with greater urgency and precision. Real-time data is critical for monitoring the spread of infectious diseases like respiratory illnesses, sexually transmitted infections, and foodborne outbreaks. This allows public health teams to respond faster and more effectively. For example, by tracking vaccine distribution and administration rates in real time, we can identify areas with low coverage and allocate additional resources or outreach efforts to ensure access and improve community protection. And when we make this data publicly available, residents can make informed decisions to protect themselves and their communities. This slide showcases a section of Washington State's Respiratory Illness Data Dashboard, an essential tool for tracking vaccination trends and disease coverage for COVID-19, RSV, and influenza, with weekly updates as data is reported to the state. The Influenza Vaccination Data Dashboard offers county-level insights, comparing the progress of the 2024-25 season against end-of-season vaccination rates from the previous 3 years. By monitoring these trends in real time rather than retroactively, public health officials can identify counties with lower coverage and allocate resources or design outreach efforts to address gaps. This targeted approach ensures more equitable vaccine access and helps protect communities statewide. Finally, while predictive analytics helps us anticipate what might happen, and real-time analytics shows us what is happening right now, prescriptive analytics takes it a step further. It suggests what actions we should take based on patterns in the data. This type of analytics uses models and algorithms to provide evidence-based recommendations, helping to guide us toward the most effective solutions. For example, prescriptive analytics can promote clean transportation by encouraging the adoption of electric vehicles, EVs, which reduces carbon emissions and improves urban air quality. It can also guide strategic investments in EV infrastructure, ensuring public spending is optimized and charging stations are effectively utilized. Additionally, it supports increased accessibility by expanding charging facilities, helping to alleviate range anxiety and making EVs a more viable option for broader populations. The EV Charge Point Placement Study is an interesting application of prescriptive analytics to support urban sustainability and public health goals. Researchers in Amsterdam used AI-driven spatial analysis to optimize the placement of EV charging stations across the city. The project analyzed extensive data sets, including urban points of interest, demographic data, and traffic patterns, to predict the demand for EV charging in different areas. By using a combination of spatial modeling and predictive algorithms, the researchers identified high-demand areas for new charging points, helping city planners make smarter decisions that promote a healthier urban environment as well as meet their economic goals. The image here compares Amsterdam's actual charging infrastructure with the optimized model, where green, yellow, and red markers indicate different predicted utilization rates. The areas shaded in red are parts of the city where predicted utilization of charging stations is low, so you can see that they do not recommend any EV stations in those corridors. The AI-driven recommendations project a 15% increase in charging point utilization, making EV infrastructure more efficient. This not only reduces costs, but encourages more residents to switch to electric vehicles, ultimately lowering urban pollution and contributing to cleaner air. It's important to note that prescriptive analytics is an emerging capability in public health and requires thoughtful implementation to ensure its outputs align with real-world needs and equity goals. We'll revisit this later when we discuss ways to mitigate bias in our analytics practice. As we've seen, each type of analytics, diagnostic, descriptive, prescriptive, real-time, and predictive, answers a specific set of questions, guiding us from understanding what happened to identifying patterns, forecasting the future, and determining the best course of action. Analytics takes us from insight to impact. To ensure these insights are reliable, accessible, and actionable, we must establish a strong foundation that includes understanding both the processes that support analytics and the capabilities they enable. The foundational elements of analytics include the underlying principles, infrastructure, and practices that support analytics work. Ensuring that data is both timely and accurate, that it is secure and accessible only to those who need it, and that interested parties and stakeholders can work collaboratively with data helps build trust, create new ideas and insights, and ensure ethical and effective decision-making. The first step to ensuring data accuracy is to properly prepare our data. This involves cleaning, transforming, organizing, and enriching the data with new information or sources. These are likely things you already do when working with spreadsheets or other raw forms of data. We'll look at an example of each of these steps using Microsoft Excel. This step is essentially the same, whether you're using a simple spreadsheet or a sophisticated software package like Microsoft Power BI or Salesforce Tableau. We'll start with cleaning data. Imagine a data set with patient records where some rows have missing data or duplicates. You might remove duplicates or fill in missing values, like replacing missing values for gender with unknown or adding the median age where it is blank. Next, we might need to transform or manipulate our data. What if our spreadsheet or dataset contains birth dates in text format, like January 1, 2000, but we need them in a standard American date format, as in 01/01/2000? Transforming data includes converting that text birth date into a numerical date field, which makes them easier to read and to sort. The next step in understanding the data we have collected is to organize it. In this example, our spreadsheet has extra columns that we don't need to include in an analysis because they don't have any inherent value. By removing extraneous columns, like a system-generated ID field and the original full name and text-formatted date of birth that we converted, we are structuring our data so that it is as easy to analyze as possible. The last step in data preparation is to enrich the data. In the example we see here, we are enriching our patient data by adding lab results from a separate data sheet. This is a common scenario where data from different sources or tables needs to be combined for more comprehensive analysis. Here we are using a simple VLOOKUP function in Excel. Once data has been collected, cleaned, and prepared for analysis, we must also consider how we will protect it to ensure data privacy, our second foundational element to analytics. Data security and governance considerations aren't just technical add-ons or afterthoughts. They are necessary to ensuring ethical use, safeguarding sensitive information, and maintaining trust with our communities. By embedding these practices into every stage of the analytics process, we create a strong framework for responsible use and decision-making.
Data protection is non-negotiable. We need to ensure that our data is safeguarded against breaches, theft, or unauthorized access. This means using encryption, processes through which data is transferred securely from point A to point B, and while stored in a database. This is often referred to data in transit and at rest. Role-based access controls ensure that only authorized users can access specific or sensitive information, and performing regular security audits helps to proactively identify and address vulnerabilities. When people trust us with their data, it's our responsibility to keep it safe.
Next, we need to be mindful of handling sensitive information. This includes safeguarding health records, personally identifiable information, and other confidential data. Compliance with privacy laws like HIPAA and FERPA is a crucial part of this effort, ensuring that we handle data responsibly and ethically. Establishing clear policies is key. These include access controls to ensure only authorized personnel can view sensitive data, secure storage systems to maintain its integrity, and define procedures for data deletion to handle information responsibly at the end of its life cycle. As we work to protect sensitive information through policies and compliance measures, it's equally important to consider the human side of data management and importance of maintaining community trust. Without trust, even the best data and insights will fail to achieve their intended goal. Transparency is critical. Stakeholders and community members need to understand how their data is collected, stored, and used. Ethical practices go hand in hand with transparency. By managing data responsibly and making decisions with the community's input, we demonstrate accountability and commitment. Finally, open communication is key when using and sharing public data. When we actively engage with stakeholders, listening to their concerns and fostering dialogue about ethical data practices, such as maintaining anonymity and reducing bias, we build the kind of trust that leads to meaningful collaboration and long-term success. We've talked about data preparation and security processes. Another foundational principle is collaboration. Engaging researchers, practitioners, and community members in the analytics process brings in diverse perspectives, enriching our understanding of the complexities we face in addressing public health challenges. This presentation focuses primarily on what happens after data is collected, but it's important to highlight the critical role of collaboration during the data collection phase. Engaging impacted communities in setting the research agenda, determining who should be included or sampled, and ensuring data collection tools are relevant is essential for creating meaningful and equitable outcomes. Collaboration helps us design solutions that are not only data-driven, but also grounded in lived experiences. By fostering multidisciplinary approaches and encouraging innovation, we strengthen relationships with partners and ensure our strategies are both inclusive and effective in addressing the needs of our communities. Enabling collaboration is essential to effective public health analytics, but making it successful requires intentional support. By creating systems and processes that enable data sharing, clear communication, and teamwork, we can bring diverse voices together to tackle complex and systemic public health challenges more effectively. Collaboration doesn't happen automatically. One component it relies on is having the right infrastructure in place to support seamless teamwork. To make this happen, we can use technology and software designed to help us analyze, share, and act on data effectively. That's where analytics and business intelligence, or ABI tools, come in. These technologies are designed to aid collaboration by simplifying data sharing, enhancing analysis, and enabling actionable insights. Tools like Amazon QuickSight, Microsoft Power BI, MicroStrategy, Qlik, and Salesforce Tableau can help organizations create engaging visualizations and turn their data into meaningful, impactful decisions. ABI tools are sophisticated software solutions that help their users interact with data throughout each stage of the analytics process. These tools can help public health professionals analyze large data sets, identify trends in specific populations or geographic areas, and predict outcomes of decisions or interventions. They can help to enable the specific capabilities that drive impactful analytics and can play a key role in effective and ethical use of artificial intelligence in our data work. Ultimately, the right ABI tool for any organization is dependent on a variety of factors, including existing technical environment, organization size, and goals for using data. While selecting the right tool is important, many of the ABIs on the market today enable 5 core capabilities of analytics for their users. These capabilities, data analysis, data visualization, report creation, content distribution, and artificial intelligence, represent the tools, techniques, and processes that public health professionals can use to generate insights, address challenges, and effectively communicate findings and outcomes. Data analysis is where we begin to uncover the insights hidden within the data we have collected. It involves examining and modeling data to discover useful information and draw meaningful conclusions. Simple tools like Excel can help us filter data, summarize information, and create basic charts. ABI tools can help users analyze large data sets, identify complex trends, and uncover deeper patterns. These enhanced capabilities, in turn, enhance our ability to understand past and current events in public health. Data analysis might help us identify nuanced trends in youth behavior, explore changes in maternal health outcomes, or predict responses to new public infrastructure. This analysis sets the stage for the remainder of the core analytics capabilities: creating visuals, generating reports, distributing insights, and incorporating advanced tools like artificial intelligence. Data visualization is the process of transforming data into graphical representations, like charts, graphs, and maps, to make complex information more accessible and easier to understand. In tools like Excel, we can create basic visualizations such as bar charts, line graphs, and scatter plots to identify trends or compare data. For example, you might use a line graph to track disease rates over time, or a pie chart to show demographic breakdowns. ABI tools can create dynamic visualizations that update in real time and handle much larger data sets. For instance, you can create heat maps to identify geographic disparities, interactive dashboards that highlight trends, or layered charts that reveal relationships across variables. ABI tools are able to enhance pattern identification for their users in such a way that they may help uncover trends that might have been missed in static visuals. They also improve data accessibility by supporting features like multiple language options, compatibility with assistive technologies for users who are blind or have low vision, and flexible content distribution formats. These capabilities ensure information is clear and actionable for a wide range of audiences, from technical teams to community stakeholders. Report creation is where we package the results of our analysis, including visuals and summaries, into meaningful outputs that can be shared with multiple audiences. In Excel, you might create tables or charts to summarize vaccination rates or hospital admissions. For example, you could present a table showing the number of flu cases across different age groups. While this is useful, the process can be manual, and updating the reports requires significant time and effort. With ABI tools, report creation can be dynamic and tailored. For instance, you could generate customized reports that include interactive charts tracking vaccination coverage by county, or highlight wins and health outcomes by race or geography. These types of reports allow you to speak directly to the needs of policymakers, community leaders, or health providers. Content distribution is about sharing data and insights in ways that are accessible, engaging, and actionable for a specific audience. A static report summarizing health trends might work well for community partners, while decision makers may also need interactive dashboards to explore vaccination coverage. ABI tools make it easy to provide both options efficiently. Delivery matters as much as the data itself. Community meetings, public websites, and tailored presentations ensure clarity, while accessibility is key. Offering materials in multiple languages and designing visuals that reflect community context. Infographics simplify complex data, while interactive portals let users dive into the details. Webinars, workshops, and social media expand reach and encourage engagement. Platforms like Instagram or Facebook are ideal for sharing quick, eye-catching visuals. These platforms are so effective that it's essential to take precautions to ensure the visuals you share are clear, contextually accurate, and cannot be easily misinterpreted or misappropriated. While ABI tools help us harness data, artificial intelligence, or AI, transforms the way we interact with that data. AI offers advanced capabilities that move us beyond traditional analysis, which can help us uncover insights and make predictions. Machine learning, a key aspect of AI, uses data to create models that improve over time. Public health professionals can use these models to forecast disease outbreaks or identify risk factors in populations. Another application is natural language processing, or NLP. This allows AI to understand and respond to human language. Imagine asking a system, which neighborhoods have the highest asthma rates, and receiving a clear, data-driven answer instantly. NLP makes analytics more accessible for everyone, not just epidemiologists or trained analysts. Then there's computer vision, where AI interprets visual information. For example, it could analyze live video to monitor air quality or track public health risks in real time. These capabilities give us new tools to tackle public health challenges more effectively. Generative AI is a rapidly evolving branch of artificial intelligence that focuses on creating new content rather than just analyzing data or predicting outcomes. You may already be familiar with tools like OpenAI's ChatGPT and DALL-E, and we're beginning to see similar capabilities integrated into ABI tools. Generative AI has the potential to significantly enhance the work of public health professionals. For example, it could read a research paper and generate a summary or abstract. It might also use natural language processing to draft campaign materials tailored to specific audiences, helping to streamline communication efforts. As with any powerful tool, responsible use is critical. While generative AI can produce highly convincing outputs, it's essential that human users carefully review and verify the content. Because generative AI creates responses based on an underlying pool of information developed by humans, it may unintentionally reinforce biases, spread misinformation, or overlook nuances critical to public health messaging. AI and generative AI offer tremendous potential, but their impact depends on thoughtful and ethical application. Throughout this presentation, we've emphasized the importance of using analytics responsibly. Mitigating bias is a crucial part of this responsibility. Even the most advanced tools can fall short if bias distorts our data, analysis, or conclusions. By addressing bias head-on, we can uphold the integrity of our work and ensure our insights drive meaningful and equitable change in our communities. Bias can start right at the beginning of our analytics journey, during data collection and preparation. Several types of bias can present themselves if we aren't thoughtful in our practices. For example, if we're only collecting data from certain groups, like those who are easiest to reach, we risk sampling bias, where the data doesn't fully represent the whole population. A survey that only reaches individuals with internet access inadvertently excludes those without access, like some older adults or those with lower incomes. An example of exclusion bias could include omitting undocumented populations from health studies, creating gaps in population health understanding. Using historical data sets that reflect outdated or discriminatory practices, rather than seeking more comprehensive or current information, could be an example of source bias. Representation bias, or the underrepresentation of certain racial or ethnic groups in research data sets, can also be present. Information bias occurs when the tools, methods, or measurements used systematically distort the data. Two common types of information bias include self-reporting bias, when participants inaccurately recall or underreport behaviors like diet or drug use, and measurement error, in which faulty equipment or inconsistent collection methods, like miscalibrated blood pressure cuffs in a clinic, systematically misrepresent actual values. Any type of bias at this stage can lead to misleading conclusions and inequitable decisions. It's crucial to recognize these biases early. The opportunity to introduce bias doesn't just stop at data collection and preparation. It can occur at every step of the analytics journey, from cleaning the data to distribution of content, often in ways we don't even realize. During data analysis, it might show up as confirmation bias, where we focus on findings that align with what we already believe or expect, overlooking contradictory or critical patterns. For instance, if we're convinced a specific intervention is effective, we might unintentionally downplay data showing it only works for certain populations. When it comes to AI, cognitive bias comes into play during model creation and deployment. Because humans design AI systems, unconscious choices, like how we define problems, select features, or clean data, can introduce bias. If we rely on AI outputs uncritically, assuming they're neutral or objective, we risk reinforcing inequities rather than challenging them. Algorithmic bias, on the other hand, stems directly from the data used to train AI systems. If the training data reflects historical inequities, excludes certain populations, or lacks diversity, the AI will reproduce and sometimes amplify those biases. For example, a predictive health tool trained on a dataset that underrepresents minority populations might fail to flag health risks for those groups, leading to disparities in care. To mitigate bias when working with data, we can follow a few basic best practices. Asking the right questions is where good data analysis starts. And it's not just about the research question. We must ask questions about the data itself. Where did it come from? Is it reliable? Could there be gaps or biases we're not seeing? These kinds of questions keep us on track and help us make sense of the data in a way that's ultimately useful. Next, we need to use diverse sources. Relying on just one dataset can leave us with blind spots. But when we pull in data from different places, like surveys, clinical records, or environmental reports, we start to see the bigger picture. It also helps to break it down. If we look at the data in segments, like age groups, neighborhoods, or income levels, we can spot trends we might have missed. For example, maybe overall flu vaccination rates are up statewide, but breaking it down by zip code shows neighborhoods that are farther behind. And finally, collaborate and review. Bring in colleagues, stakeholders, or community partners to take a second look. They might catch something you missed or provide a new perspective that makes the analysis stronger. At the end of the day, working with data is an ongoing process. New insights lead to new questions, and that's a good thing. When we're thoughtful and open-minded in how we analyze data, we're better equipped to support decisions that make a real difference. Mitigating bias doesn't stop with identifying issues during analysis. It extends into how we share our findings. The way we design and present visuals plays a huge role in ensuring that the story our data tells is accurate and accessible. This brings us to data visualization best practices. By focusing on clear, consistent, and effective visuals, we can ensure our insights are both actionable and trustworthy. After analysis, bias can sneak in when we present our data. How we choose to display or communicate findings shapes the story we tell, and we must take care to avoid opportunities for misinterpretation. Visualization bias happens when our charts or graphs emphasize certain findings, whether intentionally or not. For example, choosing a misleading scale on a graph can make minor differences look significant or hide key patterns entirely. Presentation bias refers to crafting visuals or narratives that highlight successes while downplaying areas of concern. For instance, if we're presenting a new public health program, showing only its successes without addressing limitations gives the audience an incomplete picture. These biases can impact decisions and trust, as people may act on incomplete or skewed information. That's why it's essential to follow data visualization best practices, choosing the right chart types, maintaining consistent scales, and ensuring clarity. Choosing the right chart type is one of the most important steps in effectively communicating data. Each chart has a specific purpose, and selecting the right one helps your audience understand your message clearly. Take a look at the visuals on this slide. First, we see a column chart showing infant mortality outcomes by ethnicity. This type of chart is perfect for comparisons, helping us see the differences or similarities between groups at a glance. Next, the line graph tracks the number of seasonal flu cases over several years. A line chart is an ideal choice for illustrating change over time, making it easy to spot patterns or trends as time progresses. The scatter plot provides a visual representation of the relationship between air pollution levels and asthma prevalence rates across different regions. Each dot on the chart represents a region, with the x-axis showing air pollution levels and the y-axis indicating asthma prevalence as a percentage of the population. Scatter plots help us quickly see the correlation between higher rates of pollution and the percent of the population with asthma. And finally, the pie chart breaks down funding allocations by region, showing us how each piece contributes to the whole. Pie charts work well for high-level overviews, but it's important to use them thoughtfully, as they can be harder to interpret with too many segments. The key takeaway is this: the chart type you choose should match the story you're trying to tell. After choosing the right chart, it's equally important to use consistent scales. If you start a vertical axis anywhere other than 0, even minor changes can appear exaggerated. In this slide, we compared childhood vaccination rates across 4 regions. The chart on the left, our bad example, manipulates the vertical axis to start at 60%, exaggerating the differences between the regions. While the East has the highest rate at 78% and the South the lowest at 65%, the visual makes it seem as though the gap is far larger than it truly is. The chart on the right, our good example, keeps the vertical axis consistent from 0% to 100%. This approach provides an honest and proportional view of the data, ensuring viewers can understand the actual differences between regions without distortion. Using consistent scales like this is critical for building trust and ensuring accurate data interpretation. Adding labels to the data also helps the user quickly interpret findings. As we saw in the previous example, applying consistent scales is vital for presenting data honestly. But equally important is how we design our visualizations to guide attention effectively and make patterns clear. This brings us to the concept of pre-attentive attributes, visual properties like color, size, and position that our brains process almost instantly, even before we consciously interpret the data or read labels. This bar chart from Data Haven is a strong example of how pre-attentive attributes can enhance our understanding of data. Here, the use of distinct colors to rank outcomes compared to the state average draws attention to the disparities in maternal outcomes for Black parents, as well as those in urban areas. The clear labels along the primary y-axis for demographic groups and the consistent spacing of bars along the x-axis for outcome categories make the data easy to scan and compare. The varying length of the bars, representing rates of outcomes, instantly convey disparities, with longer bars for Black parents highlighting the severity of inequities. By leveraging pre-attentive attributes thoughtfully, this chart goes beyond simply presenting data. It creates a visual narrative that is both accessible and impactful, compelling us to act on the disparities it reveals. We've seen how using color, shape, and position helps instantly highlight key insights. But what happens when a visualization presents too much information at once? That is where minimizing cognitive overload becomes essential. Let's look at a pair of examples. The chart here attempts to display vaccination rates, doses distributed, hospitalizations, and daily cases for a fictitious disease outbreak. However, the design choices make it overwhelming and unclear. A loud background and monochromatic colors create visual noise, making it difficult to distinguish between data series. Moreover, inconsistent scales between the axes further distort the relationships between these metrics, making trends harder to follow. Instead of guiding the viewer to the most important points, this chart presents an overload of information, leaving the viewer struggling to make sense of the data. This example demonstrates how poor design can obscure important findings, underscoring the need for thoughtful visualization techniques. On the next slide, we'll see how the same data can be presented in a cleaner, more accessible way to highlight the story it's trying to tell. Now let's look at how the same data can be presented more effectively. Instead of overwhelming the viewer with too many variables in a single chart, we've broken the information into two focused visualizations. The first chart highlights daily cases and hospitalizations, making it easy to compare trends over time and identify periods when hospitalizations increased or decreased in line with rising cases. With labels and distinct colors, the viewer can quickly grasp the relationship between these two metrics without distraction. The second chart focuses on daily doses administered and vaccination rates. This allows the viewer to clearly see how vaccination efforts progressed over time, with the percentage of vaccinated individuals steadily increasing as daily doses increased. By focusing each chart on a specific story, we reduce cognitive overload and make it easier for viewers to connect with the insights. Thoughtful visualization is about more than making charts look good. It's about ensuring that the message lands, that it's clear, and that it drives the right actions. And that is true for each step along our analytics journey. With that in mind, let's take a step back and look at the big picture of what we've covered in this presentation. We began by exploring different types of analytics through real-world case studies. These examples showed how data helps us understand the past, respond to the present, and prepare for the future. We also talked about the foundational elements that make all of this possible: data preparation, security, and collaboration. These are the basics that ensure we're building analytics on a solid, ethical foundation. Then, we looked at the tools and capabilities that take our work to the next level. While tools like Excel are powerful for foundational analysis, ABI platforms take things further by modernizing workflows, scaling up capabilities, and making data more accessible across teams. We reviewed the 5 core capabilities of analytics: data analysis, data visualization, report creation, content distribution, and artificial intelligence. These capabilities are crucial for making sense of complex data, sharing insights effectively, and driving actionable change. One of the most important discussions we had was about mitigating bias. Bias can creep in at any stage: data collection, analysis, visualization, or the use of AI. We explored how to spot and address it, whether through careful sampling, asking the right questions, or presenting data transparently. Mitigating bias isn't just a technical step, it's a moral commitment to equity. Finally, we explored data visualization best practices. The way we present information determines how effectively it can drive change. Clear, thoughtful visuals help us cut through complexity, focus attention on what matters, and inspire action. At the end of the day, it's not the tools that create change, it's people. It's the public health professionals, researchers, and community members who collaboratively use data to dig into root causes, advocate for policy change, and design programs. Transformation happens when we pair these tools with purpose. It's about using data responsibly, centering on equity, and making sure every insight reflects the diverse needs of the people we serve. When we do that, we're not just analyzing numbers, we're contributing to improving lives. Tools allow us to see what's possible, but it's people who make it real.